Medical Let's Talk, the series designed to bridge communication gaps in healthcare. Today, we're talking about diabetes, a condition that affects millions worldwide. Our focus is on helping both patients and healthcare professionals who are learning English to communicate more effectively about diabetes. We'll cover some essential vocabulary and common phrases that will make your conversation smoother and more informative. Let's start with some basic terms. Diabetes is a chronic condition that affects how your body turns food into energy. Most of the food you eat is broken down into sugar, also called glucose, and released into your bloodstream. When your blood sugar goes up, it signals your pancreas to release insulin. Insulin is a hormone that acts like a key to let the blood sugar into your body cells for energy. If you have diabetes, your body either doesn't make enough insulin or can't use the insulin it makes as well as it should. This causes sugar to build up in your blood. There are different types of diabetes. Type 1 diabetes. This is an autoimmune disease. Your immune system attacks and destroys the cells in your pancreas that make insulin. People with type 1 diabetes need to take insulin every day to survive. It often starts in childhood or young adulthood. Type 2 diabetes. This is the most common type. In type 2 diabetes, your body doesn't use insulin well. This is called insulin resistance. Over time, your pancreas can't make enough insulin to keep up. Type 2 diabetes can develop at any age, but it's more common in people over 40. Lifestyle factors like diet and exercise play a big role. Gestational diabetes. This type of diabetes develops during pregnancy. It usually goes away after the baby is born. However, women who have had gestational diabetes have a higher risk of developing type 2 diabetes later in life. Now, let's look at some important words related to managing diabetes. Blood sugar or blood glucose. This is the amount of sugar in your blood. It's usually measured in milligrams per deciliter, mg per dl, or millimoles per liter, mmol per L. Insulin, the hormone that helps control blood sugar. It can be taken as an injection or through an insulin pump. A1C test. This blood test measures your average blood sugar level over the past 2 to 3 months. It's a key indicator of how well your diabetes is managed. Monitoring. This refers to checking your blood sugar levels regularly. You can do this with a glucose meter or a continuous glucose monitor, CGM. Glucose meter, a small device that measures the amount of glucose in a drop of blood. Continuous glucose monitor, CGM, a device that tracks your glucose levels throughout the day and night. Hypoglycemia. This means low blood sugar. Symptoms can include shakiness, sweating, confusion, and dizziness. Hyperglycemia. This means high blood sugar. Symptoms can include increased thirst, frequent urination, fatigue, and blurred vision. Complications. These are health problems that can develop over time if diabetes is not well managed. Examples include heart disease, kidney disease, nerve damage, neuropathy, and eye problems, retinopathy. Diet. What you eat. A healthy diet is crucial for managing diabetes. This often means focusing on whole grains, fruits, vegetables, and lean proteins, and limiting sugary drinks and processed foods. Exercise or physical activity, moving your body. Regular exercise helps lower blood sugar and improves insulin sensitivity. Medication, drugs prescribed by a doctor to help manage diabetes. This can include pills or insulin injections. Healthcare professional. This includes doctors, nurses, dietitians, diabetes educators, and pharmacists who help you manage your diabetes. Let's practice some common phrases you might hear or use in a doctor's office or clinic. For patients, I have been diagnosed with diabetes. I need to check my blood sugar. What is my A1C result? I am experiencing symptoms of low blood sugar, like feeling shaky. I am feeling very thirsty and need to urinate often. Could this be high blood sugar? What foods should I avoid? How often should I exercise? What are the side effects of this medication? Can you explain my treatment plan? I have a question about my insulin dosage. For healthcare professionals, your blood sugar level is a little high today. We need to monitor your A1C. Are you experiencing any symptoms of hypoglycemia? Let's talk about your diet and exercise routine. This medication will help lower your blood sugar. It's important to check your blood sugar regularly. We need to discuss potential complications. Do you have any questions about your insulin? Let's review your treatment plan together. We recommend a follow-up appointment in 3 months. Understanding these terms and phrases can significantly improve communication. It allows patients to express their concerns clearly and for healthcare providers to explain diagnoses, treatments, and management strategies effectively. Let's break down some more specific scenarios. Scenario 1, at a doctor's appointment. Patient,
Hello, doctor. I'm here for my diabetes checkup.
doctor.
Hello, how have you been feeling? Have you been monitoring your blood sugar regularly?
Yes, I have. My numbers have been a bit high in the mornings lately.
I see. And have you noticed any symptoms like increased thirst or frequent urination?
Yes, I have been feeling more thirsty than usual.
Okay, let's check your A1C today. This will give us a good idea of your average blood sugar over the last few months. We also need to discuss your diet. Are you still following the meal plan we discussed?
I'm trying my best, but sometimes it's difficult, especially when I'm at work.
I understand. We can explore some easier meal options. It's very important to manage your blood sugar to prevent complications like nerve damage or eye problems.
What kind of complications?
Well, if blood sugar stays high for too long, it can affect your nerves, your eyes, your kidneys, and your heart. That's why we monitor it closely and adjust your treatment if needed.
I also have a question about my medication. I sometimes forget to take my pills.
It's important to take your medication as prescribed. We can discuss ways to help you remember, perhaps using a pill organizer or setting reminders on your phone.
Scenario 2, talking to a diabetes educator. Nurse,
Welcome. Today we're going to talk about how to use your glucose meter. Do you have it with you?
patient,
Yes, I do. I find it a little tricky to get a good blood sample sometimes.
That's very common. Let's walk through it. First, you need to wash your hands. Then, you'll use the lancet to prick your finger. You only need a small drop of blood.
Okay. And then I put the blood on this strip.
Exactly. Insert the strip into the meter and then touch the blood drop to the end of the strip. The meter will then show you your blood glucose reading.
So if my reading is 150 milligrams per deciliter, is that good or bad?
That's a little high for a fasting reading. Ideally, before a meal, we like to see it between 80 and 130 milligrams per deciliter. After a meal, it can go up to 180 milligrams per deciliter.
Oh, I see. And what if it's too low, like if I feel dizzy and shaky?
That sounds like hypoglycemia. If you feel that way, you should check your blood sugar immediately. If it's below 70 milligrams per deciliter, you should eat or drink something with sugar, like a juice box or some glucose tablets.
Thank you. This is very helpful.
You're welcome. Remember, regular monitoring is key to managing your diabetes effectively and preventing long-term issues. We can also discuss healthy eating and exercise to help keep your blood sugar in the target range.
Key takeaways for effective communication. For patients, don't be afraid to ask questions. Use simple language to describe your symptoms. Be honest about your challenges with managing diabetes. Learn the names of your medications and their purpose. Understand your target blood sugar and A1C goals. For healthcare professionals, speak clearly and avoid overly technical jargon. Use visual aids when possible. Check for understanding by asking patients to repeat information. Be patient and empathetic. Encourage patients to ask questions. Provide written information in clear, simple language. Learning English can be a challenge, especially when discussing complex medical topics like diabetes. By familiarizing yourself with this essential vocabulary and these common phrases, you are taking a significant step towards better understanding and communication. Remember, clear communication is a vital part of effective diabetes management and leads to better health outcomes for everyone. Thank you for joining us on Medical Let's Talk. We hope this episode has been helpful. Join us next time as we explore another important health topic.